welcome to the final presentation of the Fall 2017 season of the Medical History Interest Group. I'm Melissa Nasia. This presentation is sponsored by Lapis Library History Collections and by the Department of Bioethics and Interdisciplinary Studies. If you haven't already done so, please sign the attendance sheet. If you are attending as part of the ECU Wellness Passport program, please see Lindsay now to sign up and then see her again after the program for your stamp, and Lindsay is in blue in the back. We have not yet finalized our presentation schedule for fall 2017, but we are definitely working on it. Today's presentation is In the Beginning, the Tar Heel State and Public Health, and the presenter is E. Daniel Shingleton, Master of Social Work, ECU School Social Work, retired. We have several current exhibits. We have Desegregation in Healthcare in Eastern North Carolina, Early American Woodworking, Exploring the Natural Beauty of Wood, an exhibition by Joseph Chalovich, and Bausch and Lomb Microscopes, 1884 to 1972. So here is Dr. Suzanne Lee from the ECU Department of Public Health and past president of the North Carolina Public Health Association to introduce Dan Shingleton.
Thank you, Melissa. And welcome everybody on Monday afternoon to the Public Health History Interest Group. So I asked Melissa if I could introduce Dan because he's a good friend of mine and he has been a longtime supporter of public health. I first met Dan when he was giving a tour of a public health history sites in Asheville, North Carolina in 2005, where a group of physicians met in 1909 to form the North Carolina Boards of Health. As a history buff myself, listening to Dan recite the synthesis of people, places, and events that form the foundation of public health in our state, I realized that Dan is also one of those people. Dan's role in public health history includes serving as a public health social worker for over 30 years to make a difference in the lives of his clients. He has taught multiple generations of social workers, probably some of your relatives or even some of you in the room, at the East Carolina College of Social Work. In 2016, Dan was invited to give the prestigious Wood Lecture at the North Carolina Public Health Association annual meeting, named after Thomas Fanning Wood, about whom Dan will speak today. But Dan's contribution is greater than his role as a revered teacher and mentor. Dan's role in public health history will be remembered for what he has retained for all of us. And some of those examples are on the display here. Starting in 2007, Dan began donating his extensive collection of public health artifacts to the Lapis Library here at East Carolina University. The E. Daniel Shingleton Public Health Collection contains over 200 entries, including North Carolina Public Health Association and North Carolina Board of Health publications, North Carolina State Board of Health photographs, film strips, and oral histories of public health practitioners from 1988 to 1995, and manuscripts dating as far back as 1892. And you can see some of these examples on the slide here. Let's highlight a couple of these for you. The article from 1922 in the middle here, January 1922, relation of state and county in public health work. So that's pretty relevant today, isn't it? And then how about the article from 1924, A Garden for Health? The caption under this garden from June 1924 reads, "The climate and soil of all sections of North Carolina combine to amply reward efforts intelligently applied toward the production of vegetables and fruits. To promote and maintain health, vegetables and fruits are essential. Grow them in your own garden." How true is that for today? Yes, Jan Shingleton has cultivated the soil by preserving North Carolina public health history, allowing us to share and grow our community garden to promote public health. Thank you, Dan, for being here today.
In the beginning does raise an interesting question about the entire issue of how the public health movement started in North Carolina. I've been tempted to go back to native peoples that anthropologists say have lived in what is now North Carolina for 10,000 years. They're bound to have really intriguing public health practices, food preparation. I used to teach a course on Native Americans in North Carolina, and we would visit various places, preparation of food, hygiene. So it would be an interesting study right by itself. But what I chose to do is to move forward in time somewhat and first mention in the 18th century, there are two different laws that's dated from 1712 to 1751 that dealt with quarantine. And I know I've shared this with some of you in the room, but most of you probably don't know this. It's really kind of interesting given this week that the word quarantine really is traceable in the Western world, traceable back to maritime quarantine. Specifically, is traceable back to Venice in Italy, where I actually have taken students on several occasions, since it's a port city. Now remember, it was in response to bubonic plague or the Black Death. And hundreds of years before germ theory came along, but the people in Venice and eventually other places figure out there must be some relationship between ships arriving in our harbor and people getting sick in this town. So they figured out, well, the thing for us to do, and this was one of the practices at the quarantine station in Southport. What we should do is when the ship arrives, go out and inspect the ship and see if anyone is sick on board, and if they are, require them to stay on the ship and not come into the town. But then the dilemma was, if we find somebody who's sick, how long should we require them to stay on the ship? So they started looking for numbers. And eventually they went to the Jewish and Christian scriptures and came up with the number 40. There's 40 days of the flood, 40 Moses, 40 days on the mountain, Jesus, 40 days in the wilderness, the 40 days of Lent. So the English word quarantine comes from the Italian word 40, which is really kind of fascinating. All words are fascinating in the sense that they have a history, etc. So early work, people who were interested in protecting public health. Incidentally, the history of public health in the United States is really caught up with our port cities because of communicable disease and the need for quarantine and so forth. So in the 18th century, two pieces of legislation were passed to try to keep ships from coming into the mouth of the Cape Fear River and traveling up the Cape Fear River to try to protect the population or the villages that had developed along the Cape Fear River from such things as yellow fever, which I'll talk about a little bit later on. In the latter part of the 19th century, this was a better picture, but this actually was a quarantine station that was built in the Cape Fear River near the opening of the Cape Fear, the river itself. At one time it was called Smithville, it's now called Southport. I'm sure many of you have been to Southport. And this was actually built out into the river. Over on that side was actually a hospital, which was used for quarantine purposes. And that was built in the latter part of the 19th century and was used for a number of years. If you go there now and look for it, it's gone. It finally burned. But there is a piling left there that you can see. So once again, the effort to keep ships who had sick people on board. It's not completely successful, as you learn in a few minutes. And some of these slides, that is an example of the previous one's example of maritime quarantine. Many people call this inland quarantine, and I've shown this. I've had the privilege of teaching a number of nursing students over the years, and some nursing students said that I staged this, that this couldn't be true. I said, no, it's true. Some people call that inland quarantine, and that actually is a picture of a public health nurse posting a quarantine sign. You see whooping cough on it. My mother told me years and years ago that I actually was quarantined, and I said, well, what for? And she said, you had German measles, and you were actually quarantined. So in addition to probably the only person in the room who's ever been quarantined, I'm probably the only person in the room who has a smallpox scar, which is, oh, there are others. Great, great. What I'm going to do is talk about briefly, we could spend an hour each or more on each one of these topics, but on the lecture today is really a tribute to two Eastern North Carolina physicians. One who was born in Pantego, which is in Beaufort County, and one who's born in New Hanover County, Wilmington. Dr. Thomas Fanning Wood, the reason that these two gentlemen were selected, Dr. Thomas Fanning Wood is known as the father of the public health movement in the state of North Carolina. And Dr. Solomon, I love his name, which is also biblically connected. His name was Solomon Sampson Satchwell. Fascinating name. Incredible person, as you'll see in a few minutes. He actually made the speech at the North Carolina Medical Society that convinced the Medical Society to send a delegation to the General Assembly and plead with them to start a public health program in our state. That is a picture of Dr. Wood. And then the brief, I did this for students. I see some students are here. I did it also for Melissa. She said, do this in some kind of chronological order, and I'll get to that in just a few minutes. Dr. Wood, as you see, was born in February of 1841 in Wilmington, the son of Robert Barclay Wood and Mary Ann Wilbur Wood. He attended public schools in Wilmington. The reason we know these things is near the end of his life, he was out in the western part of the state inspecting prison camp for health purposes. And he fell ill, and he was bedridden for 18 months with an aneurysm, which was the treatment of the day. And he wrote his autobiographical memoirs, and I had the family gave me a copy of it, and the copy is now in Lawford's library if anyone. It's an unpublished manuscript, which is a rather lengthy summary of his life and work. He went to what we would call high school at Oddfellow School, and he became very interested early in life in science and medicine, and his dream was to become a physician. And you see there, he developed an interest in attending UNC Chapel Hill. And I shared this with Melissa earlier, but this is too good to pass by. This is the March 2012 edition of Our State Magazine. Philip Girard, who is associated for years and years as a creative writing program at UNCW, wrote an entire series of articles about the Civil War and North Carolina connections, and two of those articles are about Dr. Wood, and I'm going to quote from the first one about a school in Chapel Hill that Dr. Wood wanted to attend. He says, his heart is set on enrolling in the University of North Carolina to study medicine, but his father, a brick mason and builder, wouldn't hear of it. His father says that young men go to Chapel Hill to learn nothing more than how to dress like gentlemen and act like rowdies. Which is just great. It goes on to explain, probably for financial reasons, he was not able to go. He assisted his uncle and his dad in building projects, and they became famous builders, North Carolina builders. They're written up in North Carolina architectural histories. the lighthouse, on Hunting Island in South Carolina was a product of their work and so forth. In 1861, his life was changed forever because Fort Sumter was attacked, and he enlisted in the Confederate Army and served in the Confederate Army until he got sick, and long story short, he ended up in Moore Hospital, named for Samuel Preston Moore, who was the Surgeon General of the Confederate Army, and became a steward in that hospital, and he was then encouraged to go to the Medical College of Virginia while he was serving as a soldier in the Army, and he went for, believe it or not, 8 months and took his examinations and passed, and he became a surgeon in the Confederate Army. After the war, he returns to Wilmington to practice medicine. And I'll say more about what he did after he came back after the war. That's a portrait of Dr. Wood, hangs in the New Hanover County Health Department. That's his son, Edward Jenner Wood, who was a very famous North Carolina physician, who wrote a book which is also in the library, a rare book, which is in this library, published in 1912, called A Treatise on Pellagra, which I would encourage you to look at. That's Dr. Wood's home in Wilmington, and it was the home of the State Board of Health, the first home of the North Carolina State Board of Health. And the State Board of Health was housed there until he died in 1892. Some of my students call that history on a stick. On 3rd Street in Wilmington, within sight of that building, which is in the background. This is where the first home of the State Board of Health. His house was where that brick building is now, and that's the New Hanover County Library. And he would have been very pleased for that building to be there, because when he died, he was president of the Library Society. His book collection is in the Wilson Library in Chapel Hill. That is his grave site, and the young lady in front is Dr. Wood's great-granddaughter. Next person I want to discuss is Solomon Sampson Satchwell. I'll move through this. Born in Pantego, Beaufort County. I would tell you if I had time about the difference between Beaufort and Beaufort, other than 2 different towns in 2 different states. You see, he went to Wake Forest College, then went to medical school at New York University, practiced medicine in Wilmington, Washington, what people around here call Little Washington, Long Branch, New Hanover County, which is Wilmington, and Pender County, which is Burgo. And in 1860, studied medicine at the Sorbonne, which is quite remarkable. In 1861, he became surgeon in charge of Confederate Hospital No. 2, which is in Wilson. And if I had time, I would talk to you about the roots of this university being in Wilson. Another story. In fact, he served as the surgeon in charge of the Confederate Hospital for its entirety of its existence. In 1865, he returns to what is now Pender County. It used to be part of New Hanover County, but is in 1875 became a county unto its own, and he practiced medicine there for the rest of his life. And he became an extremely active member of the North Carolina Medical Society, and more about that in a few minutes. Following, I thought this was really interesting, when he lived in Washington, Little Washington, his across the street neighbor was a young lady named Susan Dymock, and he actually presented her papers to the North Carolina Medical Society for her to become first licensed physician in North Carolina. She got a provisional license of some sort, but she never practiced in this state. She went to Boston and practiced medicine. And in 1892, you see there that Dr. Satchwell died from typhoid fever. The story is that in his last days, he had patients who had typhoid fever, and he hired 2 assistants to actually pick him up and take him to see his patients to his dying day. There's history on the stick. founder of the State Medical Society in 1849, head of the Confederate Hospital in Wilson. And students always, when I talk about these things, students want to know, well, how many Confederate hospitals were there in North Carolina? I have a list of them up here. I'm not going to go through them, but I think there were 13. It's another story. Somebody should write a book about those hospitals. Fascinating story. This is in Wilson, Confederate, headed by Dr. Solomon Satchwell. Wilson Female Seminary before that. It's now part of the Civil War Trails. What remains of it is, there's Dr. Satchwell's picture. Actually, the building that the Confederate Hospital became in was Wilson Female Seminary, and the Confederacy took it over and turned it into a hospital. There you see a picture of that. And that's what remains of the hospital. The Wilson County Historical Society has saved that part of it, and one can go and view. And this is a mass grave at Maplewood Cemetery in Wilson, in which all the soldiers that died in that hospital are buried. And they're not a very good picture, but they're their names. It's a story unto itself. If you're looking at one volume history of Civil War, I would highly recommend James McPherson's book. I'll say more about that in a few minutes. When I started learning about these two physicians, I said, well, you know, what led them to an interest in public health, and what led them to their interest in public health was practicing medicine during the Civil War. And Margaret Humphreys, who is a professor of the history of medicine at Duke, wrote this really interesting book. Chapter 10 in this book, the title of chapter 10 is Public Health Legacy. Fascinating chapter about the impact that the war had on, not only in our state, but in other states, with the creation of public health movements in various states. The last chapter in the book is titled Post-War Medicine, and the Civil War had a major impact on the practice of medicine in a general sense, also in our state. Drew Faust is president of Harvard University. Fascinating, disturbing book about what death, how death transformed how Americans thought about death, a good death, a sacrificial death, how preachers preached about it, how writers wrote about it, etc. The common figure that I used to run into in terms of how many deaths there were in the American Civil War, combatant deaths of 620, 650,000. Over time, that number has gone up. And I got really disturbed, which I hope I could talk to you about, because I kept, well, how many civilian deaths were there? And Jim McPherson in his book says there are 50,000. Well, we know now there were many more. Margaret Humphrey said in her book that the Civil War was the greatest medical crisis that ever faced the United States of America, and it was the cause of 1 million deaths. And I just really looked and looked and looked where that number came from. Two classic works, Doctors in Gray, H.H. Cunningham, who has ties to Barton College and Elon. This is a classic. And in the last chapter of that book, Professor Cunningham speaks once again to the impact that the war had on the public health movement and in medicine in the United States. It's an old classic. Incidentally, before I go, I don't want to be unfair. I didn't put this in there, and then I felt guilty. There's also a book called Doctors in Blue. You have to be careful about these things. Have to be politically correct. I don't understand why anybody would write a book called Doctors in Blue and put a red cover on it myself, but it's kind of strange. And this is an old classic too. These books came out in the 1950s and 60s. And then there's quite a growing literature, including person that's in the room, Todd Savick, is growing literature about the impact of medicine and so forth, Civil War medicine. And once again, in fairness, Jonathan Letterman was the Surgeon General of the Union Army during the war, and he is credited with, in many ways, being transformative in the practice of military medicine. In for instance, the whole business about transportation and battlefield. Interesting book about other kinds of destruction. I'm reading in a North Carolina historical review in the issue. Somebody's written a book or forthcoming on the environmental impact of the American Civil War. And then it goes on. That's a picture of the harbor in Wilmington in the Civil War. It's called the Lifeline of the Confederacy. And when Fort Fisher fell, which is down near the entrance of the Cape Fear River, eventually Wilmington was occupied and the war came to an end. A word about yellow fever, which these two doctors would have known quite well. In July of 1862, a packet ship, the name of it was Kate, ran the blockade, came up the river, and unloaded what most people believe were foodstuff. Remember, this is the supply line for the Army of Northern Virginia, and so forth and so on. Well, in a few weeks after Kate arrived, a disease, which had visited Wilmington before in 1821 and so forth, but a terrible disease visited Wilmington. Remember, Wilmington until 1910 was the largest city in North Carolina. So it had grown. I've seen various population estimates, but in a few weeks, hundreds of people had died from yellow fever, and Dr. Wood's family left Wilmington and went up to Lumberton. And people that had any resources would have left town. I should tell you, because I was discussing this with somebody came, there were 3 clergymen, the rector of St. James Episcopal Church, the priest at the Catholic Church, the Roman Catholic Church, and John Lamb Pritchard, who this book is about. The original of this book is in this library. This is a reprint. Stayed at their post to minister to their congregations, and all 3 of those clergymen died from yellow fever. Also, Dr. James Dixon, who was an extremely well-known physician in North Carolina. He'd been the president of the Medical Society. He died from yellow fever. And Dr. Wood and Dr. Satchwell would have had families in that area and known all about this and so forth. It surely had an impact on them. Lower Cape Fear Historical Society, which is housed in a house in Latimer House that actually Dr. Wood's father and uncle built. Beautiful house. Oakdale Cemetery, you see many yellow fever victims. That is in Wilmington called Yellow Fever Hill, which is also a mass grave. We had some of you remember the superintendent of that cemetery came up here and gave a presentation with Dave Rice from New Animal Health Department, and yours truly some time ago. That's Dr. Dixon's grave marker, and this is John Lamb Pritchard from the First Baptist Church grave marker. He's a very young man. Beside him, his son that died prematurely. I guess all of you know, speaking about Civil War, I guess all of you know that Abraham Lincoln had and Mary had 4 boys. The oldest one, see if I can remember, the oldest one was named Robert, and he is the only child they had that survived to adulthood. The other 2 children, the second one was named Edward, or Eddie, called him Eddie. He died from typhoid fever. He died from tuberculosis. Little Willie, or William, died from typhoid fever. And then his last son was named Thomas, and he died at age 18 from some kind of coronary event. So it's a really interesting story and the impact that public health had on the president's family. issues related to public health, the experience they had in practicing medicine in the Army, and Dr. Satchwell in at the Confederate Hospital No. 2 in Wilson, and some of the issues that they would have been exposed to during these periods, and obviously very influential were medical preparedness, which health departments are concerned about to this very moment, battlefield care and evacuation, the whole business about transportation, ambulance, preparation, training for people that move folks from the battlefield to hospitals, infections. To hear about the conditions in the camps is just beyond belief. So poor hygiene, disease. Remember, 2/3 of all the 650 or 750 or 850, who knows, people who died in the war were from disease. Whoops, sorry. Sanitation, just heart of public health work in many ways, nutrition issues, and then vital records. For the first time during the war, doctors had to keep some sort of vital records. I think dating from 1913 in our state, everybody who's born in our state now has a birth certificate and death certificate. Vital records are important for research, for knowing what's going on, for epidemiology, what's going on in human populations. And then this unbelievable story. When Dr. Wood and Dr. Satchwell came home from the war, it was a terrible, Wilmington was occupied, but there was this great influence of freed people, former slaves who came into Wilmington in the southeast of North Carolina, and there was a terrible smallpox epidemic that greeted them when they came home. In fact, Jim Downs in this book, which I highly recommend, called Sick from Freedom, is really a story. I'll show you a picture of it in a minute. He says on page 15, the most devastating medical crisis that erupted throughout the post-war South was the smallpox epidemic. And he goes on, this traumatic episode claimed the lives of thousands of freed slaves from 1862 to 1868. And this is what greeted Satchwell and Wood when they came back home. Jim Downs also deals with the plight of the slaves. That made no sense to me, particularly when I saw Margaret Humphrey's million people died as a result of the war. It made no sense to me that 2/3 of the soldiers died from diseases and infections. I guess all of you know about the Camp Falls. A lot of freed slaves and groups followed Union Army people around and so forth and so on. If that happened to the soldiers and they were traveling around the various parts of the southern states and fighting in battles, et cetera, to be sure that thousands of freed people were dealing with disease. And I've always wondered, I looked at the 1860 census, and the 1860 census said there's 3.9 million slaves in the United States. I've always wondered how they found out about they were freed. And then I've always wondered about what happened to them after they were freed. And of course, the excitement about freedom and so forth and so on goes so far because there are all kinds of other issues that come up about what kind of work, what kind of health care, what kind of legal rights, all these kinds of things that would come up. A book that was really a revelation to me in many ways. That is a picture of a human face with smallpox. So unbelievably destructive disease. I think the figures are on average before it was done away with, it killed 2 million people a year. And that's out of one of the health bulletins, a piece of health education, obviously, about the importance of immunizations. And the 2 children, obviously, on either side of that child were immunized. I've had public health nurses who used to work in this area said that those pustules would eventually erupt, and said when they would get out of their car to visit somebody with smallpox, you could smell the odor just from it's just unbelievable the destructive nature of that, and and tuberculosis. When I was working on this lecture for another reason, which Suzanne mentioned, it was August the 19th, and the news came up on the internet that Dr. Donald Henderson had died. And there you see a book about smallpox. Dr. Henderson was a dean of Johns Hopkins School of Public Health, was a famous epidemiologist, and he headed the campaign to eradicate smallpox from 1967 to 1977, and I believe in 1977 it was announced that smallpox was no more. So it was quite remarkable. I had a physician friend who said, always remember that no disease has ever been eradicated by treatment. The only way you can eradicate disease is by prevention, which is good. The North Carolina Medical Society, both Dr. Wood and Dr. Satchwell were presidents of the North Carolina Medical Society, and it was through the Medical Society that they traced a map for the creation of the public health program in the United States. You see that the Medical Society started in 1799, then it didn't meet for a while. Then it met starting in 1849. It met and did not meet during the Civil Wars, and started again in 1866. And here's the chronology for you, Melissa. After the war, there was discussion, obviously, in the Medical Society, probably led by Satchwell and Wood, about prevention of disease. We need to do something about preventing smallpox. We need to do something about preventing yellow fever. We need to do something about preventing communicable diseases, and the path to that is by creating a public health program. And in 1872, the Medical Society met in New Bern, and the minutes of the society at that time outlined a contentious issue. And finally, one of the physicians said, public health is best left to the press and the pulpit. And he won the day, and the Medical Society decided not to do anything else. But Dr. Wood and Dr. Satchwell were not easily persuaded. So in 1875, they had a meeting in Wilmington of a group of Eastern North Carolina physicians, and they decided to pursue the issue even more. And then in 1876, the North Carolina Medical Society meets in Fayetteville, and what happened there changed the whole process. Dr. Satchwell, who was known as a famous orator, speaker, was asked to give a speech about public health at the Fayetteville meeting. It was in May of 1876. And thanks to Melissa, she found the speech in the Transactions of the North Carolina Medical Society. You see Fayetteville and so forth and so on. And that's first page of on state medicine, preventable diseases. Now I declare unto you, I have witnesses of this. I do have a copy of the speech. It's 22 pages long of text just like this. And I like to joke, I'm glad Dr. Satchwell's not here, I like to joke that people got so bored they finally just said, yeah, we'll do anything if you'll stop talking. But you probably feel the same way right now. But at any rate, the minutes of the Medical Society says it was such a persuasive case, argument for the creation of a public health program, that the Medical Society, believe it or not, decided to send a delegation of physicians, and they said to memorialize, but it means to lobby. 5 physicians, when the General Assembly met the next year in 1877, these physicians went to Raleigh and stayed there and lobbied the General Assembly, pleaded with the General Assembly to please do something about a public health program, a formal public health program for the state of North Carolina. And sure enough, the General Assembly agreed. But there's a little bit more to the story. They did agree to create the State Board of Health. And then, in the best remarkable story, they appropriated some money for the board. Remember, the board was a board and an agency. They appropriated the sum of $100 for the first 12 months the public health program in North Carolina. Today, I checked the other day, today the state Division of Health Services is 9.2 million. It has 1,700 employees, and there are 6,500 people work in our various health departments in North Carolina. Pitt County Health Department is celebrating their 100th year. And for those that know much about the history of East Carolina Teachers Training School, the General Assembly appropriated $15,000 for the creation of the school that we're at right now, and $5,000 a year for its continuing maintenance. Just on the basis of a dream, here we are now. And when I drive up here, I think about how all this came to be. It's quite remarkable. In 1878, the board produced its first educational pamphlet, which is fascinating to me, Timely Aid for Drowning and Suffocating. When my daughter went to East Carolina, the thing that she dreaded the most, which I think is now gone, is to graduate from East Carolina. At that time, you had to swim the length of an Olympic-sized pool 4 times. You couldn't graduate unless you could prove you could swim, which is a life-saving piece of knowledge to know if you think about it. One other observation, and I'll stop. Sometime when I show this, I remind students, remember the board had $100. And it also is, in terms of us, in terms of the practice of medicine, we should remember something else. Because the transition from miasma theory and other theories about the causative factors of diseases was slow in coming. These things don't happen overnight, and so I'm somewhat defensive about the board and Dr. Wood, after a while, was taking money out of his own pocket. I'll give you an example and fascinating book. In 1881, now germ theory had been known for years before that and accepted in most of Europe. But in 1881, on July the 2nd of 1881, James Garfield, the President of the United States, who'd gotten elected 4 months before that time, walked in a train station. He was going to take a trip to the Jersey Shore for vacation. And a man came out, a disgruntled person who thought he should have had a job in the Garfield administration, shot him twice. 1 bullet in the arm and 1 bullet in the abdomen. He lived until September the 19th. During that time, he had, now this is the President of the United States. During that time, he had 16 different physicians who tended over him. You should read, if you want to know how far we've come and how slow we are getting there, you should read a book by Candace Millar called Destiny of the Republic. It's a fascinating, really kind of disturbing story about how these things come so slowly. 2 other slides, not that one.
Dave, can I ask a question?
I'm sorry.
Can you go back 1 slide?
Sure.
Can you wait?
Oh, sure. Well, it's just about this one. I was wondering about the way it's written, timely aid for drowned and suffocated, because wouldn't that be too late to drown and suffocate?
Well, that was the title of it.
Use that.
I'm sorry.
I was wondering, because the wording just seems strange, because drowned would mean they've already drowned, and suffocated means they've already suffocated.
That's true. I do not know who gave that
You didn't talk
pamphlet its title. I've never seen one. If you find one, I'd love to have it. I mean, we can put it in archives,
It
but
seems strange the way it's worded.
Todd has a
It's
comment.
resuscitation. It's the whole concept of resuscitation.
Okay. For someone who's almost drowned. Yes, okay.
Okay, so that we can get this on here. You were concerned about the
I was
drowned and suffocated.
Yeah. My question was just about the wording. It's almost like that's would be past, drowned and suffocated. Means it's already happened, but he was saying it's about resuscitation.
One footnote while Melissa's moving around. Notice I've not even mentioned the health departments. just mentioned the state agency and how it got going. Remember, there are 83 health departments. Some of them are in districts. Each one, Pitt County, for example, has a unique history. I wish more people were interested in public history, and it's really fascinating. And also, we should encourage people to save documents from the past. I can't tell you how many health departments I've been in. You have any old documents or minutes or anything, and they say, well, you should have been here last year. We had a closet full and we threw it away. Any other questions or comments, please?
If you have a question, please raise your hand and I'll take the mic to you. This is being recorded. We want to have both the question and the answer on the tape. Otherwise, somebody viewing it would be quite confused.
This reminds me, and I'll hush, reminds me of something a student told me years ago. The mind can absorb only what the fanny can endure. Any comments? Todd, please.
This is really interesting, and I guess my question has to do with the origins of the idea of public health in North Carolina, and why would folks oppose it? In other words, what were the arguments that would say no? I mean, the concept public health makes sense, but why would somebody say, like the quote that you gave about it's only good for...
Oh, thank you, Dr.
Yeah.
Savitt. I don't know why in our own day and time people are opposed to public education and cutting public education budgets and so forth. I will never understand that. The idea about creating a public health program in North Carolina did not really catch on until after the American Civil War. I really can't find much reference in terms of interest, or organized or otherwise, before the American Civil War. And for reasons that I've described earlier about the impact that it had on particular physicians and others who were in the war, and the need for prevention. Public health is the art and science of protecting and improving. I used to ask nursing students on an exam, public health is the science and art and science of protecting and improving the health of, and they would fill in patients. It's the art and science of protecting and improving the health of the community. So I agree with you, it's just invaluable. And I also used to ask, how many people in the room use the public health service today? And nobody raised their hand. And after about 4 times, somebody raised their hand and said, I think I remember when my mother took me to the health department to get my immunizations. There's 10 million people in North Carolina. There's not a soul in this state that hadn't used public health service today. If you had a drink of water, public water supplies, so public health service, throwing away trash, use the bathroom. Students love grades. I ask them, you been to McDonald's or wherever, Bojangles, wondering, oh, I love French fries. Anyway, you been out to eat today? Yeah, I said, you see a grade in there? And well, yeah, I saw an A on the wall. You like A's? Yeah, well, you know where it came from? No. Well, it came from an environmental health specialist who inspects restaurants on behalf of the citizenry. How many of you go in restaurants and go back to inspect the kitchen and make sure the refrigeration is right, et cetera? And it goes on and on and on, and it's all invisible, but let an outbreak come and everybody will say, well, where's the health department? I need to find a health department. We're really kind of spoiled in that regard. Take it for granted. A lot of people in the world don't. Please.
Let me make one announcement. First of all, if you are here for the passport program, see Lindsay in the back. If you haven't signed in, there's a sign-in sheet. That's your payment to us. And there are refreshments in the back.
Thank you. What were other cities and/or states doing similar things at the same time as, shall we say, the etiology of public health in North Carolina was in Wilmington? Was something happening in Boston? New York,
Thank you.
Philadelphia, New Orleans.
Thank you.
Charleston.
I forgot to share with you, Charles Rosenberg, who is the husband of the president of Harvard University. He's a medical historian. And he says in his book on cholera that 1866 is the most important year in the history of public health in the United States, because the Metropolitan Board of Health in New York was started that year, and it was the first major community effort to try to eradicate or prevent a disease. So Massachusetts State Board of Health, Louisiana came along with the State Board of Health, and the health departments, believe it or not, didn't appear. Many people believe that Guilford County Health Department, which is Greensboro, started on June the 1st, 1911, was the first health department, county health department in the United States. There's some debate about that, but Robinson County Health Department in Lumberton, there's history on the stick there. It says it's 1912, the first rural health department in the United States, Lumberton, North Carolina. This state started one of the first public health dental programs, first family planning, public health family planning programs. A remarkable story that we should all be proud of, and particularly its origin in our region of the state is remarkable. But thanks.
Anybody else?
The general prevailing theory was miasma.
Yes,
The
sir.
theory of germ was not believed. So why would you want to waste time with germ theory when everybody knows that miasma is the way things have been for the last 20 centuries? So that's why there was a lot of opposition. I mean, physicians and everybody else were taught, you got diseases from bad air. You didn't get it from
Correct.
germs.
Correct.
That was quackery.
That raises the whole issue of the history of ideas and how ideas change. There's David Blight, who teaches in the history department at Yale, has written some really interesting books about how we remember things and how we change our minds and how we select certain things to remember and latch on to, and it's a fascinating issue. Yeah, if it's true, if you believe it's true. What was it? W.I. Thomas in sociology has, it's called a Thomas theorem. What people believe to be true will be true in its consequences. It doesn't have to be true, it just has to be believed to be true, which is your point, I think.
I mean, it was only until after 1860s that Snow and Semmelweis and Pasteur and eventually
Yes.
Koch, their ideas became convincing.
Absolutely. Thanks.
Anybody else?
Suzanne,
Thank you, Dan, for being here today. My question relates to your collection that you donated to the Laupas Medical History Library. So can you comment on how you acquired these documents over the years, and then also some content that you think a public health student might be interested in doing some research on?
oh. I'll be right back. Well, in your introduction, there are over 2,000 items in the collection now. This is something that I would think any student would be, it's only one of a kind. When this came to the library, the Wilson Library in Chapel Hill, wouldn't know if they could borrow it to copy it because they didn't have one. Now you think about it, the Southern Historical Collection didn't have one, and they digitized. All these are digitized. But this is volume 1, number 1, of the first bulletin of the State Board of Health. And it was published, it says in Wilmington, it was published in Dr. Wood's house. So these came out monthly for years. So there's a treasure trove. The health department started reporting. There are reports that miasma theory, the early health directors in the state reported what the prevailing winds were in their county during the month because the disease is traveling in the prevailing winds, what people believed. So these are treasure trove of things. The biennial reports of the State Board of Health. The history of our health departments is desperately in need of research. I think Pitt County has searched everywhere to try to reconstruct their history. By the way, there was a health director in in Pitt County named Charles O'Hagan Laughinghouse, who was a health director here, who became one of our state health directors later on. A very interesting person. Was instrumental in starting Caswell School in Kinston and so forth. Okay.
How did you get the book?
I'm sorry?
Where did you get the book from?
This book?
Where did you get the book from?
Well, there is a history to it. I think somewhere in here it says, no, not in this one. There was a public health library in Raleigh, and the librarian there, I'll make this short, was a dear friend, and she called me up one day and says, we have been ordered to take the library elsewhere, and it's in much smaller space, and we just don't have room for stuff here, and I'm afraid that some of it will end up at the landfill. And if you want to come up here and look through it and get things that you think are valuable, you come and do that, and that's what I did. It's heartbreaking that so many people treat the past as something to be thrown out. There is no past. It's all here now, just in this university, and how it began. It's all here. That's how it came to be. I found a lot of other stuff just in the library too. So somebody said, well, you stole something from the state. No, I just went there and gave it to another agency of the state, which is East Carolina University. And I love its fact it found a home here. Well, enough. I know you all are tired of sitting. Thank you for being here.
I'd like to make one comment, that Dr. Laughinghouse was very important in Pitt County and helped establish what became Pitt County Memorial Hospital, now Vidant Medical Center.
Yes. Thank you so much for being here. Thank you.
Again, there are refreshments.
Thank you.
Please sign in
I'm
if you
glad.
haven't already done so.
I told several people it's a good time to